In this video, I'm going to talk about the relationship between glyceroneogenesis and type 2 diabetes. So first of all, we'll look at the regulation of glyceroneogenesis. So in adipose, we have the fatty acid which is stored as thioglycerol, and for this to happen, we must have the pyruvate which become oxaloacetate, which in turn will become phosphoenol pyruvate. And now, after multi-reaction or multi-step to occur, we will have the glycerol 3-phosphate. Okay. Okay. So now we'll talk about which hormone will regulate the glyceroneogenesis. So the hormone that may regulate the glyceroneogenesis, which is the formation of glycerol 3-phosphate from pyruvate, is called the glucocorticoid, which is a steroid hormone. So the way we regulate the formation of glycerol 3-phosphate from pyruvate is by inactivating the enzyme called PEP carboxykinase. By inactivating this molecule, many things will happen. So once this molecule is inactivated, we will not have the formation of glycerol 3-phosphate from pyruvate. And because of that, there will not be fatty acid conversion into thioglycerol, because for thioglycerol to be stored into adipose tissue, there must be the reaction of fatty acid with glycerol 3-phosphate. So we have glycerol 2-phosphate plus fatty acid, which becomes thioglycerol. But because the enzyme PEP carboxykinase will be inactivated by the steroid hormone glucocorticoid, there will be no formation of glycerol 3-phosphate. And this will lead to the release of fatty acid in the blood tissue. And now, when we have the release of fatty acid in the blood tissue, it will lead to the increase in insulin resistance. So if we have insulin resistance increase in blood tissue, this is type 2 diabetes. Okay, I'm gonna kind of do like a summary. So first of all, what do we need? We need fatty acid to be stored in adipose tissue as triglycerol. And for that to occur, we need the pyruvate to be converted into glycerol 3-phosphate by the process of glyceroneogenesis. But because we have the steroid hormone glucocorticoid that will inactivate the enzyme PEP carboxykinase, there will be no formation of glycerol 3-phosphate. And if we have no formation of glycerol 3-phosphate, there will be no reaction with fatty acid. So fatty acid will be free and be released in the blood tissue. So the way to go around it is by the presence of the dark class thiazolidinedione. We have a drug called actose within this class, and this drug will activate the PEP carboxykinase. And when we have the PEP carboxykinase activated, now the process will occur. We will have the pyruvate transform into glycerol 3-phosphate. And when we have glycerol 3-phosphate, it will react with fatty acid and becomes triglycerol, which will be stored in adipose tissue. So this is the relationship with glyceroneogenesis and type 2 diabetes. Thank you for listening, and I'll see you in the next video. Bye.